Our project is on functional electrical stimulation by Taylor, Rebecca, Brent, Joey, and myself, Hannah. What is functional electrical stimulation? This is substitution in the event of a peripheral nerve injury. It can be used to support the individual or to help retrain the nerve and facilitate that muscle contraction. The target patient population for use of functional electrical stimulation is someone with multiple sclerosis, MSCI, stroke, or really any kind of condition that would affect your peripheral motor system. This is seen in the upper extremities, often used in the hand and forearm with grasp. Also in the lower extremities, if the individual is having problems with dorsiflexion and subsequent foot drop.
FES equipment can come in many different shapes and sizes. Some devices include an external electrical box with wires that carry the impulse to the electrodes that are then attached to the patient, like the image on the left. And then other units may have a more cuff-like appearance with a control unit and a switch like the image on the right. A physical therapist can help to determine the appropriate placement and parameters for these devices.
So Taylor mentioned parameters. For parameters for FES, generally, we're going to want a low frequency. And these parameters can also vary depending on the goal of treatment. But these are the generalizing ranges of what we'd want with FES. So as mentioned earlier, with FES, these are low level electrical impulses, hence why we want a low frequency sent to the peripheral nerves to get muscle contractions. These impulses are administered via the adhesive pads or cuffs connected to the FES unit. They're placed over the skin of the desired muscle to help with movement. And so these contractions coupled with like a functional task, as in the picture, like the patient is reaching and grabbing. So these pads attached to those muscles are helping him with that task.
So some indication for use, who it qualifies for it. So you want to make sure that the patient has a peripheral nerve, because if they have a complete severage of the peripheral nerve, then you don't really have any electrical stimulation that can activate those muscles. It's also used for patients with functional use, as seen in this picture. The Nest L300 or the walk aid is also known as. This is to help with dorsiflexion, as mentioned by Hannah earlier about for drop foot. Most of the time that they use this is because that is such a complex case that they want to try to limit the amount of things that they need to work on. And so there's just like another way to functionally use it. It's also used to retrain the CNS system, and especially like the brain function, kind of like provide that neuroplasticity growth through the PNS system. And then also seen in this other functional use, the RT300 bike is using the other leg to facilitate the movement, increase the range of motion. This is great for endurance training, building that cardiovascular, that strength, and then also using the upper extremity for other usage. Contraindications. So there's pictures of the few common ones that we see with FES, patients with pacemakers, patients with active DVT as seen in the Wells criteria, patients with any like skin breakdown, such as this venous ulcer indicated in this picture, or patients with any fractures. You don't want them to be contracting, causing fractures to make it even worse. There is an exclusion criteria that one organization produced. The exclusion criteria includes under 18 years of age, poor skin condition, poorly controlled epilepsy, a history of autonomic dysreflexia, and spinal cord injury. So those are just some things that you need to watch out for. Again, it's very patient specific, and you want to keep an eye out for these things.
Many people who use FES are able to regain or improve their functional capacity in many ways. FES may help someone to sit up, stand, walk short distances, use their hands again, and restore bodily functions. More specifically, FES may help to improve muscular function needed to feed oneself, hold and write with a pen, and even regain bowel and bladder control. Therefore, becoming independent in these tasks may improve an individual's overall quality of life. The gains in muscular strength and the ability to exercise can indirectly decrease the risk for a DVT, cardiac disease, muscle spasm, and even increase circulation and bone mass.
So there's a wide variety of research, and this study looked at upper extremity functioning following a spinal cord injury and a stroke. The research showed that there was an increase in neuroplasticity and restored function following the injury to the nervous system. This allowed for repeated practice with minimal input from a therapist. It can also be useful for home use, but the article does state that it's not as helpful or as flexible as it would be by a PT-led session. They really emphasize that there's a trade-off between the low cost and high repetition by the device itself, with also a pairing personalized treatment and protocol by a licensed physical therapist.
Because this was demonstrated in randomized controlled trials, this is considered level 1A evidence, further proving the use of this treatment with patients who have peripheral nerve deficits. And these are our resources.